Hello everyone. Now we will discuss about the tissue repair. Repair or healing is the restoration of tissue architecture and function after an injury. So after an injury, restoration of tissue architecture and function is known as repair or healing. Repair, usually the term repair used for parenchymal and connective tissue restoration, and the term healing used for surface epithelia restoration. The repair can be achieved by regeneration or scarring. In regeneration, some tissues of the body are able to replace the damaged component and return to the normal state. Like after an injury, the remaining cell of that particular organ proliferate and replace the damaged cell, or local tissue stem cell proliferate and restore the normal state of that tissue or organ. On the other hand, in scarring, when the injured tissue is incapable of regeneration, then there will be scarring. Then repair done by fibrosis, meaning deposition of the collagen, and it provides the structural stability. A term organization stands for fibrosis develops in tissue spaces occupied by inflammatory exudate. Whenever a tissue space which is filled with or occupied by inflammatory exudate, whenever a fibrosis sets in such spaces, this is known as organization. This is the diagrammatic representation which depicts in mild or superficial injury there will be a regeneration or replacement of this denuded epithelial lining, and in severe injury, as we can see, the deposition of fibrous tissue and fibroblast in scar formation. Cell and tissue regeneration. Now we will discuss in detail about the cell and tissue regeneration. A growth factor stimulates stem cells to produce new progeny or for cell proliferation, or result in cell proliferation. Integrity of extracellular matrix is very essential in regeneration. There are some principles that we need to know of cell proliferation. General principle of cell proliferation. First is we will see in cell proliferation there is a mechanism of signals and control. Several cell types proliferate during repair, like remnants of the injured cells to restore the normal structure, vascular endothelial cell, they form new blood vessel for the nutrient supply, and the fibroblast to lay down the collagen or scar formation. So these three types of the cell which proliferate during the repair process. The ability of a tissue to repair is determined by two factors. First is intrinsic proliferative capacity of that tissue or cell, and second is presence of tissue stem cell. So the ability of tissue to repair is determined by two main things. First is intrinsic proliferative capacity. Second is presence of tissue stem cell. Based on these two categories, or based on these two things, tissue of body are divided into three groups: labile tissue, stable tissue, or permanent tissue. Labile tissue, they are continuously dividing tissue. Because of the continuous loss, they need to replace the lost tissue with the normal cell. Tissue stem cells play an important role in labile tissue. Examples of labile tissue are hematopoietic stem cells in bone marrow, surface epithelia of oral cavity, skin, vagina, and cervix, cuboidal epithelia of the duct of exocrine glands, columnar epithelia of GIT, uterus, fallopian tube, and transitional epithelia of urinary tract. These all are the example of labile tissue. They continuously divide to replace the lost cell, and tissue stem cells has very important role in labile tissue. Now the second category is stable tissue or stable cells. Normally the cells is present in quiescent stage or G0 stage of the cell cycle. In stable tissue, they have a very minimal proliferative activity, and they are capable of dividing, but only in response to injury. Examples of the stable tissue are parenchyma of the most solid organ like liver, kidney, pancreas, endothelial cells, and fibroblast, and smooth muscle cells. They also are the example of stable tissue. Now the third group is permanent tissue. They are usually terminally differentiated and do not have the capacity or ability to divide further. Examples of permanent tissue is majority of the neurons, cardiac muscle cells, and skeletal muscle cell. Although a satellite cells which is attached to endomysial sheath in skeletal muscle provides some regenerative capacity to the skeletal muscle. So these are the three main tissue type in the body: labile, stable, and permanent, on the basis of their ability to repair. Growth factor and extracellular matrix stimulate various signaling pathways which result into the DNA replication and the biosynthesis of the various cellular component, and this will result into the cell proliferation. Growth factor mostly secreted by macrophages, epithelial cells, and the stromal cells. Now we will see, after the cell proliferation, tissue regeneration. We will discuss about the liver regeneration. This is a prototype example of tissue regeneration. Liver cells have the high capacity to regenerate. And how this regeneration takes place: proliferation of remaining hepatocytes. After the injury, proliferation of the remaining hepatocyte, which follow three phases. First is priming of the hepatocyte. How this priming of hepatocyte occur? Kupper cells, macrophages, local macrophages of the liver release interleukin 6, which make hepatocyte competent to receive and respond to growth factors. So in priming of hepatocyte, interleukin 6 plays an important role. The next phase is growth factor phase. Hepatocyte growth factor and TGF alpha stimulate primed hepatocyte and promote primed hepatocyte, then enter into the cell cycle from quiescent state and result into the hepatocyte proliferation. Proliferation of Cooper cells, endothelial cell, satellite cells were also noted after the hepatocyte proliferation. Now third phase in regeneration is hepatocyte return to the quiescent stage, and in this phase TGF beta plays an important role. In liver regeneration, we have discussed about the proliferation of remaining hepatocyte in three phases. Phase 1 is priming of hepatocyte, phase 2 is growth factor phase, and phase 3 is termination phase. And on the other hand, regeneration can takes place by a repopulation of hepatocyte from the progenitor cells. In chronic liver injury and inflammation, hepatocyte proliferative capacity usually decrease very severely and they cannot regenerate. In that case, some progenitor cells in liver that present in the canal of Herring repopulate and repopulate and fulfill the demand of the damaged cells. So this is the tissue regeneration we have discussed, particularly in the setup of liver injury by proliferation of remaining hepatocyte or by repopulation from the progenitor cells. Restoration of normal tissue structure can occur only if residual tissue is structurally intact. This is a very important line. If the residual tissue is structurally intact, then only the restoration can occur. The structural integrity of residual tissue is very important for the regeneration or restoration of the normal tissue structure. Now we will see the repair by connective tissue deposition. If repair cannot be accomplished by regeneration, then what happens? The connective tissue deposition will be there and there will be a scar formation which provide an structural stability. Now we will discuss about the steps involved in scar formation. First of all, there will be injury along with the inflammation, which result into the cell proliferation of epithelial cell proliferation, endothelial cell proliferation, and fibroblast proliferation by various cytokines and growth factor. After the cell proliferation, there will be a formation of granulation tissue. Granulation tissue composed of fibroblast, delicate capillaries, loose extracellular matrix, and mononuclear cell, mainly macrophages. Deposition of connective tissue. The next step of scar formation after the granulation tissue formation is deposition of connective tissue on this granulation tissue, and this will result into the fibrous scar formation. Alternatively activated macrophages, M2 macrophage, clear the dead tissue and offending agent and they secrete growth factor and cytokine, which will result into the proliferation of fibroblast, and fibroblast will result into the deposition of connective tissue like collagen. The steps involved in the formation of granulation tissue and scar. First is angiogenesis. Angiogenesis is synthesis of blood vessel. Second is deposition of connective tissue, and third is remodeling of that deposited connective tissue. So we will discuss them one by one. First is angiogenesis, a new blood vessel development from the existing blood vessel. Now there are some steps in the development of angiogenesis. First is there will be a vasodilation and increased vascular permeability. Vasodilation mediated by nitric oxide and increased vascular permeability due to VEGF, vascular endothelial growth factor. After the vasodilation, there will be a separation of pericyte and the breakdown of basement membrane, and there will be this is the vasodilation, and after the vasodilation there will be a separation of pericytes and breakdown of basement membrane will result into the basal sprout from the main blood vessel. This is a basal sprout. Endothelial cells then start migrating toward the areas of tissue injury in this basal sprout. Proliferation of these endothelial cells takes place. After the proliferation of these endothelial cells, there will be a remodeling into capillary tubes and recruitment of the periendothelial cells, pericyte and smooth muscle cells. And lastly, the suppression of endothelial proliferation, migration and deposition of basement membrane. This is a diagrammatical representation. This is a quiescent vessel. So for the angiogenesis, there are some mediators like nitric oxide and VEGF. They result into the increased vascular permeability or vasodilation. After the vasodilation, there will be a sprout formation, a new blood vessel. This we can see. Pericyte detachment is important for this basal sprout. Subsequently, these basal sprout elongated by various signals and form a new blood vessel by the proliferation of endothelial cell, the proliferation of endothelial cells, pericytes. Now we will see the various mediators and their role in angiogenesis. VEGF-A, this plays an important role in migration and proliferation of endothelial cells. FGF2, this will result into the increased proliferation of endothelial cells. Angiopoietin 1 and 2, they are responsible for the structural maturation of the new vessel. PDGF, this will be responsible for the smooth muscle recruitment. TGF beta, this inhibit the endothelial cell proliferation and migration. This will help into the remodeling and also responsible for the production of extracellular matrix. VEGF stimulate notch ligand on endothelial cells, which further stimulate the notch receptor, and through a notch signaling pathway sprouting and branching of the new vessel occurred. So these are the various mediators and their role in angiogenesis. Now the second step, as we have covered the angiogenesis, second step in granulation tissue and scar formation is deposition of the connective tissue. So there are two steps in deposition of connective tissue. First is migration and proliferation of fibroblast. Second is deposition of extracellular matrix protein by these cells. PDGF, FGF2, TGF beta, they released by the alternatively activated M2 macrophages. TGF beta is the most important cytokine for the deposition of connective tissue proteins. The third step in granulation tissue and scar formation is remodeling of the connective tissue. After deposition of connective tissue, there will be remodeling of this connective tissue by matrix metalloproteinases. They are zinc based enzyme. Broadly they have three categories: MMP 1, 2 and 3, which will be responsible for the remodeling of fibrillar collagen. Gelatinases, which will be responsible for the remodeling of amorphous collagen and fibronectin. And third is stromalysins. They modify or remodel laminin, fibronectin, amorphous collagen and proteoglycans. There are tissue inhibitors of matrix metalloproteinases. They inhibit the functioning of matrix metalloproteinases. Now we will see the factors that can influence or affect the tissue repair. First is infection. Infection of the injured site can result into the delayed tissue repair. Diabetes can also delay the repair of the tissue. Nutritional status, deficiency of protein and vitamin C will also result into the delayed healing, as these are very important for the connective tissue deposition. Glucocorticoid inhibit the TGF beta. As we know, TGF beta is the most important enzyme for the deposition of connective tissue. Mechanical factors, like if the site of injury is under pressure or tension, then this will also result into the delayed tissue repair. A foreign body present at the site of injury or site of repair will further hamper the process of tissue repair. Poor perfusion of that site is also a factor that can delay the tissue repair. Type and extent of tissue injury and tissue. As we have discussed, there are three types of tissue: labile, stable and permanent. On the basis of their capacity to regenerate, the tissue repair will occur. Or this also based on the type of tissue injury. If there is a severe tissue injury, this will also result into the delayed healing or somewhat healing by the scar formation. Location of the injury may also play an important role in tissue repair. Now we will briefly discuss about the abnormalities in the tissue repair. So first is the defect in healing. If the healing is delayed, this will result into the development of chronic wounds like venous leg ulcer, arterial ulcer, diabetic ulcer and pressure sores. On the other hand, excessive scarring will result into the hypertrophic scar or keloid formation. In hypertrophic scar, the original wound is within the the boundaries of the scar is within the original wound, but in keloid, scar tissue grows beyond the boundaries of the original wound and it usually does not regress. So thank you for your time.